It is our Safely Back to School week here on Open Live, and we would love you to be a part of it. Go ahead and give us a call if you have a question for any of our education associations in the area. We're joined by the leader of the Rutherford County Education Association and also Metro Nashville Education Association. So if you're a teacher and have concerns, if you're a parent and have questions on how teachers are going about all this new learning and the new styles we have to learn in, go ahead and chime in. We'd love to hear from you. 615-737+ is the number. We have Reverend Fuzz on the line. Reverend, thank you for joining us tonight. And I do want to ask you, first of all, how you're doing.
Can you hear me okay?
I can, Reverend Fuzz. I do want to know how you're doing, first of all.
I'm doing good. I'm tired, but a lot of fatigue. But I have so much support. I got to fight for all that support that I have. I've been familiar with NEA for over 30 years. I've known staff there. I've spoken to school teachers. I was surprised a month ago, several school teachers told me, I'm not going back to school. They're not going to get me in that school. And I thought about if I were to announce that I'm going to start having church, over half my members they're just not going to come. And I'm trying to think, how do you all feel this is going to play out in our schools when they open? Will these teachers come to school? How can you have school if you don't have teachers or if you don't have staff? And then for one other person, what would you say to the governor if you were in a meeting with him one-on-one or just a couple of y'all around the table? What would you say to the governor in response to his encouragement to open the schools in Tennessee? What would you say? That's my kind of question. Thank you.
Excellent. Thank you, Reverend Fuzz, and we wish you continued health. We're praying for you.
Thank you.
Amanda, I'm going to let you start. I think that's a great question. If you could have a one-on-one or a small roundtable with the governor, what would you say today?
Yeah, and thank you, Reverend Fuzz. We are glad to hear you are doing better. What I would say is, look, all teachers want schools to go back into session. So we need your help. We need you to do what it takes to bring down the infection rates in Tennessee. And that means you're going to have to make some decisions about requiring masks, about, regulating bars and restaurants, because the reality is, until that infection rate goes down, it's not safe to go back to school in person. And so help us make that happen. The other thing I would say is fund it, make it, if you want us to be back in school, then make sure that we have enough teachers to have small class sizes, that our buildings are in good working condition, and that we just have what we need to serve our students. We don't have the funding to make that happen even before COVID. So that's what I would ask.
And Laura, what would you say to the governor? Anything else to add to that?
Really, I couldn't have said it better myself. Again, please consider the numbers and the safety of all of us. I know Reverend Fuzz, initially his question with regard to, God forbid we go back to school and teachers start dropping like flies, for lack of a better way to say it. And, this safe haven that is school for all of us, all of a sudden it falls apart. I mean, you can't have school without teachers. You can't have school without students.
Can I ask you both, have you seen the numbers, actual concrete numbers of teachers who have said, I'm out, I'm retiring, I'm going to take an absence this year? Are there numbers for that in either of your districts?
I don't know that we have concrete numbers, but I can honestly tell you we have been inundated with communication from educators, and they have been seriously weighing their options. They're looking at early retirement. If they're close to retirement, others are looking at resignation, leaves of absences, and some, sadly enough, some phenomenal educators are even going so far as to possibly leaving the profession. And, we already have we already have a teacher shortage, and so that is very alarming.
Amanda, do you have any hard numbers?
No, but that is something we're trying to find out. And I would say we're seeing the same thing that Laura said. I get calls constantly from teachers who are trying to figure out, can they retire early? How does leave work? Because I had one teacher tell me, I either figure out how to retire early or I'm going to have to update my will. And I say that to say how very serious this is for our educators. They're scared to death. And it just really speaks to why we need the governor to kind of step up here and to, provide some of that leadership that means that we can get back to school safely.
All right, we're going to get back to the phones now. Lori is on the line. Lori, go ahead with your question or comment.
Yes. I live in a county up here. It's in Macon County. It's not a big county. And I just wanted to ask the governor, our superintendent has the COVID and another or two, overseeing the schools. And would he want his child to go into a school like that he know the superintendent had the COVID? And we're nearly at 800 cases. And like I said, it's a small county, so I wish he would really give it some thought and prayers about it.
We will. Thank you, Lori, for calling in. We will most certainly see his plan tomorrow. Alan is on the line. Alan, you've got the floor. Go ahead.
Well, I just wanted to bring up that there's actually 3 pandemics going on.
Okay.
You got your medical pandemic with the COVID-19. You got your financial pandemic with all the businesses that's been closed and struggling to survive. We also have a social pandemic with our children. And if you watched any of the news stories Sunday morning on TV, our children need that socialization. So if we don't have that socialization for our children, in the future, we're gonna pay for that. I have a great friend that's a teacher in Rutherford County. I understand where she's coming from, and not wanting to bring any of these germs home to her family, and she's concerned. But there's got to be some happy medium with all of those 3 pandemics.
Yeah, that's a great point, Alan. Thank you for your call. I'd love to hear what you have to say about that, Laura.
Well, I think going back to what Amanda was saying, if we had the funding and we could at this time make the school a safe place with the safeguards, but we do not have the ability to do that. Social distancing, for instance, is huge. We have no way to adequately social distance and uphold the CDC guidelines at this time. I went to see my primary care physician recently, and I think he said it best. He said, as a doctor, I care first and foremost about lives. But he says, I have to understand the governor to the degree that he is not looking solely at lives, and it's not his job to look solely at lives. He also has to look at things like the economy, which I thought, was very big of him to make that observation, and really took me aback myself. And I thought of that as well. But in response to the man who's called in, again, if the students get sick, if the teachers get sick, and there's no way we can socialize at all. I mean, the reality is we won't be alive to socialize. So in this situation, yes, we're educators and it's so near and dear to our hearts, but safety has to come first. I mean, that's what we do as teachers with students. We always say they have to have, they have to have food. They have to have this, they have to have that before they are receptive to learning. It's the same here. We have to have safety come first before the learning. It always precedes learning.
Amanda, I wanted to ask you about one of the points on the list of what MNEA came out with today about what you all would like to see before in-person resumes. And number one, you say, we demand that all education stakeholders call for online instruction until there have been 14 days with no new cases in our counties. Dr. Jahangir has been on the show a number of times with me. We've spent hours together talking about this, and he has told me this virus may never, ever, ever go away. We will likely never get down to 0 cases. So it makes me wonder about this first point. 14 days with no new cases in a county before school resumes in person, that may never happen.
Well, I'm hoping that, we're closing in on being able to inoculate people against this, right? So there is advancements in the science. We're looking at, we haven't gotten rid of a lot of diseases, but we're able to control them because, we can inoculate people against it. So I don't think that we're looking at a situation where, one case pops up here or randomly with a lot of time in between it and another case pops up there. I think what we're trying to say is that as this pandemic continues to rage, we need it to stop. Because even though I know we're in an economic crisis, the economic crisis is being caused by the health crisis, and that's not going to stop until we address the health crisis. Mm-hmm. So until we stop doing things that make the infection rate go up, we're going to continue to be in this situation. And I understand so strongly about the social and emotional needs of students. I mean, my heart breaks to not see my students and to not be able to, give them a hug and see them in person and high five and all of that. But Laura's right. Even if we were in the classroom, we wouldn't be able to do that anyway. Yeah. And so, we have to, if Tennessee, if the United States is going to actually beat this pandemic, then we got to buckle down and do the things that are going to make those numbers go down. And I think that's why we're trying to really push that point. I don't think it's the, that there can never be another case of coronavirus again.
But that's what that point says. Wouldn't it be better if it was something realistic, like we want to see a 14-day trend of downward cases and a positivity rate under 5%, which is what the WHO suggests? Wouldn't that be realistic?
Yeah, I mean, I think that's essentially what we're saying. We're saying the same thing. It's just hard to say all of that, and communicate it in a soundbite, and not everybody knows quite what we're talking about when we say something like that. But I mean, that's essentially what we're saying. But we're pushing the point because what we have seen is, at the beginning of this, a lot of our leaders were saying things like, we're going to follow the science, we're going to follow the numbers. And then as the pandemic really didn't go away, a lot of our leaders sort of backed away from that and said, well, no, it's okay, we'll just continue to, go back to normal. And then we've seen huge spikes. And so we feel like taking a hard line to push back is what is needed. Do we think actually that schools will stay closed until that happens? Probably not. But we have to sort of push the envelope here because it has been pushed so far the other way. I mean, we're looking at really Memphis and Nashville being the only schools going completely online right now, and a great number of our districts having really no protections at all. And that's going to be disastrous. And so we feel like, maybe we really need to push back strongly in order to get to something that will actually work.
I hear you. Okay, let's try to sneak in one more phone call before we have to head to break. Daryl's on the line. Daryl, thank you for your patience. Go ahead.
Hey, good evening, Carrie.
Hi.
And good evening to your two guests. I'm going to put it this way, and I'm going to cut to the chase. My mom was a teacher for 27 years in Metro altogether. After she retired, she decided she wanted to get her doctorate degree. She already had a master's. She went to Vanderbilt Peabody and received her EDD. she passed in 2013, but if she was alive right now, she would say, why are you willing to think we used to hold kids as precious? They're our future, you know, and now we're willing to let an administration on the federal level and the state level to put them in here like bait. The president, even though he said it's not that big, it's a hoax, but he yet made everybody sign a liability that you won't sue if you go to this rally. So you're not that confident that people won't catch it. And what's going to happen, just because you want to make everything look normal, this is never going to look normal. We need to stop the football. We need to stop the baseball. It's not like we're not going to die if we don't have those stupid sports and everything. And if we all stay in this and stayed in phase one, we probably will be to a point where it would have been contained. Now we're basically having to go backwards because I guess Chamber of Commerce of the state and everybody, my business is going down. Well, the whole bunch of business is going down, but it will continue to go down if we keep trying to play like this deadly disease doesn't exist. And I hang up and listen to your response. Good night.
Right. Thank you, Daryl. Daryl's very passionate, and I think a lot of people feel like we have one foot on each side of the line here, and we're trying to make it work, right?
Yeah, absolutely. I mean, what Laura said earlier, teachers in Rutherford are going back to school on Monday, and they don't quite know what they have in front of them. And, all we're asking is for our leaders to help us out here. Just make it so that we can go back safely. Let's all work together in Tennessee to bring those numbers down so we can go back to school. And we really need our leaders to make that happen.
Okay, we're going to sneak in a quick break here. We will be back to continue this discussion right after this.